Sickweather, Forecasting the Future of Healthcare. Objectives. The purpose of this presentation is to describe the use of Sickweather.com in relation to innovative multimedia solutions in healthcare. It will determine its threats to healthcare organizations. It will also predict the partnership between the website and existing organizations to provide better health care to patients. The conclusion will present a summary of the main points addressed. Product overview. Sickweather.com was created in 2012 by Graham Dodge, CEO. It is an internet website and mobile app used to track virus outbreaks and illnesses through interactions with social media. For example, if 10 people who happen to live in Grand Rapids, Michigan post a Facebook or Twitter status saying, "I have the flu," or "there's a stomach virus going around in my son's middle school," Sickweather will map it and make it available for reference. The software uses algorithm filters and qualifies data that cross-references between the location tags to produce real-time weather maps. Sickweather boasts that it is able to predict illness 2 to 4 weeks before the media. The example below shows a map of the U.S. with red dots representing areas of illness throughout the nation. This was obtained by plugging in my personal location data. Since time is limited, this area presents a 2012 one-on-one interview between Dodge and a nurse practitioner policy strategist, Joy Twisige, to learn more information independently. Threats Sickweather.com may pose to existing organizations include word of mouth. Word of mouth is not always a good thing because people speak from their own experiences and do not all have the same authentic agenda. Furthermore, conversations and communication that may be innocuous can be judged differently when made available through online public. Reliability of information, different definitions. For instance, if someone posts, "I am so sick today," this could mean anything from a cold to a headache. If someone says nausea and vomiting for the last few days, it does not necessarily have to mean from a stomach virus. It could be anxiety, food poisoning, or even a pregnancy. If the algorithms cannot distinguish between a general phrase and authentic illness, this may cause confusion in mapping. Hospital and facility flooding. Creating something similar to a somatic, psychosomatic, or hypochondria disorder, people often see symptoms and automatically believe that they have the same thing. If people believe there is a stomach virus going around and they happen to have a stomach ache from, say, indigestion, it may send them to the hospital or doctor's office for unnecessary treatment. This can have an impact on insurance companies who have to foot most of the bill and leave less room for patients who truly need treatment. Reputation issues. Since Sickweather.com cross-references data with post locations and facilities, if a person shows disdain or a lack of treatment at a specific facility, it may have a negative impact on the healthcare organization. Violations of privacy. Although individuals post information on the internet social sites, privacy settings are usually put in place to keep information confidential or strictly among friends. If Sickweather pulls from posts such as these, the organization as well as healthcare facilities mentioned could be subject to lawsuits. Partnership with existing organizations. These are partnerships with this existing organization can provide better care through disruptive innovation. According to Freights, disruptive innovation transfers specific medical skills into technology-based care to provide patients with easier access to care outside of a clinical setting. Sickweather has the potential to bring this to patients with the added bonus of affordability. Accurate collaborations between professional teams and social site predictors have the potential to thrive. Examples of this would be providing a 24-hour helpline or a live chat for questioning that is easily accessed through the website. Word of mouth. As much as word of mouth can be a threat to health organizations, it can also be a positive. In fact, researchers show that approximately 80% of patients born from 1961 through the present rely on friends, family, and social media to obtain physician and facility recommendations. If Sickweather were able to add a small advertising section where healthcare providers could spread information, organizations could witness better quality care settings. The chart below is a representation of such findings. Recruitment. Improving customer ratings. Since healthcare industry requires specialized skills, organizations have moved beyond placing advertisements in conventional media and have targeted social channels and have focused on websites. Just like word of mouth, partnering has the power to engage more patients on a social level and will allow them to feel a higher level of trust and comfort with healthcare providers. Patient education. If Sickweather could partner with specialized professionals, either nurse practitioners, physicians, etc., who would provide education for the illness they predict, it could help counteract most of the proposed threats. For instance, if sickweather.com predicts an outbreak of the flu in a specific area, physician-approved links could be added to the website on symptoms, prevention, and possible treatments or comfort measures. It could also provide information on when it is necessary to contact a doctor or seek medical treatment. Conclusion. Sickweather.com proves to be a useful tool that can serve as a gateway between traditional healthcare and today's technology. Word of mouth can be a help or a hindrance to disruptive innovation techniques, depending on how it is presented and authenticated. Patient education has the potential to dramatically reduce hospital flooding and boost reputation. And it is important to remember to remain mindful of privacy laws and steer clear of violations in order for disruptive innovation of this magnitude to be successful. Thank you.